Yo, but we've got another one coming. Stay right where you are because in a moment, a National Medical Director for Primary Care for NHS England, Dr. Claire Fuller, is going to be joining us. Now, Dr. Claire Fuller is a practicing GP in the primary care medical and director for NHS England. She was previously the CEO for Surrey Heartland's Integrated Care System, having had leadership roles within Surrey for a decade with a focus on the wider determinants of health, population health management, and a drive to make sure it's as easy as possible to deliver and receive good quality care. Claire, very warm welcome to the studio.
Well, thank you very much, Simon. Nice to be here.
And tell us a little bit about your role, what it involves now, your day-to-day job, if you will.
Well, so my new job, which isn't new anymore, I've been in it about 9-10 months. I'm the primary care medical director for NHS England. And I have to say it's an extraordinary job. It's an absolutely extraordinary job. So my day-to-day business varies in a way that I hadn't anticipated, but largely is focused on GPs as a profession, focused on delivery, and much more on general practice as a provider, rather than necessarily the commissioning of general practice. So I always say I've got all the good bits of the profession.
Fantastic. And in terms of sessions, I believe you've already done one today, haven't
I've
you?
done two.
You've done two.
I know.
Isn't it? Been busy. We've had you working out. I believe first one, best practice in primary care.
Yes, that's right. So Amanda Doyle and I both talking about best practice in primary care and not mentioning the future at all.
No, we don't talk about the future. But tell us about that session, though. Tell us roughly the topics you covered. I know we haven't got time for the full session, but what were the sort of main topics you were discussing?
So for those of us that know us well, so it was Ruth Rankin from NHS, from Confed, who was chairing, and basically it was rapid fire questions fired at Amanda and I for about an hour and a half.
Okay.
Yeah, yes, indeed.
And how was that?
Well, we're both quite used to it. We're quite good. So, and it was very broad. So it was all of primary care. So not just general practice, pharmacy, optometry, and dentistry as well. And talking about things that are working well currently around the country, and talking about leadership, talking about many of the challenges, and talking about current policy. And in particular, we talked about the new locally led test sites that are being started in 7 ICBs around the country, and about how the work we're going to be doing with them, led by the ICBs, looking at how we might the future model of care within general practice.
Fantastic. And I say, you got a morning of questions. I'm going to fire some more at you now.
Yeah, I know. That is your job.
Seasoned professional at this, so as you're expecting. Your other session was delivering holistic care for interconnected disease.
Yes.
And how to overcome systematic hurdles. Talk us through that.
Yeah, so that's a very complicated way of saying how do you join everything up to make it better for patients.
Thank you very much for explaining.
And it's basically what we're all here to do, isn't it? And it's what everybody's job is. How do you make it easier for professionals to deliver care and easier for patients to receive care in a way and in a setting that works for both professionals and for people?
And I've got top tips off the back of that coming out of it. What would you love people to take away?
It's all about the people, isn't it? It's all about the people. It's all about longevity of relationships, and it's all about never losing sight of what matters. So as leaders, I think it's beholden upon us to make it as easy as possible for people to work together from multiple organisations, and that might be for how we commission care, or just the hurdles and the barriers that we put in place, whether it even be like a referral form or the permissions required for things. But for people, we just need to make sure the customer service bit is as good as it can be. So, you know, if you are old and unwell, or if you're unwell and you're anxious, or that it is easy for you to seek the care that you need.
In terms of people, there's a lot of people in the hall here today.
Yeah,
we said it was buzzing before, but it is every stage is packed. The aisles are packed. Every stand's packed. Have you had much time for socialising, networking, catching up, or have we been working you too hard on the stages as well?
Oh, it's delightful, isn't it? It's absolutely delightful. I've seen. So I'm quite extroverted, and I'm very extroverted. And even as extroverted as I am, I'm feeling slightly. I need to go and sit in a dark room.
Oh, really?
Oh, there's so many people.
It's been peopled out.
Oh, there's so many people that I haven't seen for so long, and it's absolutely fabulous, isn't it?
And in terms of your background, like what was your initial sort of inspiration to get into healthcare initially? How did it all begin?
Well, I'm a third generation GP.
Okay.
Yeah, so my grandfather was a GP, and to echo Amanda P's theme of Nye Betham, so my grandfather was a GP in Peterborough, and was a regional medical director and was involved in actually setting up the NHS in 1948.
Oh, wow.
Yeah, and then my aunt was a GP in Ely, and I'm the third generation.
So has it literally been from a
It's
child?
yeah,
I'm
it's
just
a
going
family
to...
business, isn't
Is
it?
it?
It's a
Yeah,
family
absolutely
no,
fantastic.
so yeah, always been, and interesting, always wanted to be a GP. It was not doing medicine. I've always wanted to be a GP, all the way through medical school, all the way through.
Excellent. And in terms of the show as a whole, have you had any key takeaways so far? Have you anything surprised you? Have you seen anything new, innovative, different?
I think the buzz is much more hopeful and positive than I was expecting. I thought Amanda's speech was really good, and I thought captured the challenge as well as the optimism. But I think there is so much good work that's going on, and people are excited and want to talk about it. So I think that, if anything, that's the thing that has really struck me, is the energy in this building is extraordinary.
Oh, that's interesting because there are some misconceptions about the NHS, how people are feeling at the minute. Obviously, that surprised you. Do you think there's any other sort of misconceptions that you want to outline, put to bed, and go, it's not actually like that? It's not potentially what people might think.
Well, so the thing so in my new job, so I now work for NHS England rather than in the broader service. I think the thing I keep saying is just how many incredibly clever people there are working incredibly hard to improve patient care, and that the jobs that we do, they are a great privilege to be able to work and to influence the service as a whole and to make things better. So I think it's just understanding just how hard people are working and how much energy and hope and optimism there is, and we are and people are so committed to the NHS and to making it better.
That's nice to hear because we've been talking about new people thinking about joining the NHS as a career. What would you say to?
I mean, I know honestly, I would do it. I would do it again. I would do it, absolutely do it again. I think the thing within careers within the NHS is the flexibility that I hadn't appreciated. So I've got so many colleagues that started not in the jobs they were in, or so many colleagues that started your frontline working, and the opportunities to actually change and do different careers within the NHS is amazing.
Have you got any other examples about sort of good practices within the NHS that people might not know about, that you think more people should know about?
So I'm going to give a plug for a session that's happening at 3:30. Go and see the primary secondary care interface. So there's been a lot of talk about the difficulties between primary and secondary care. And actually there's some really good work going on. So Kieran Collinson, who's my deputy, is leading a session with Stella Vig, who's my secondary care medical director, and working with exemplars around the country about really good working of GPs working with consultant colleagues about, again, how you improve and how you change the pathway, how consultants working in GP practices, consultants working in the community, just a completely different way of working that makes sense.
Okay, and in terms of, I know your family's been in the NHS for some time. There's been changes and things. Have you seen anything, heard anything, discussed anything that really excites you about the future?
Well, you've got to look at some of the tech stuff, haven't you? I mean, I think it is going to be game changing. So some of the stuff around big data about finding people that don't usually seek help and seek care, and identifying those really vulnerable populations through looking at the data. So I was in Manchester yesterday, and they know they've got 51,000 people that use emergency services but are not registered with GPs, so do not get the proactive care and the real supportive care. So the ability of tech to identify people and target help more specifically, I think will be a real game changer.
And are you an adopter of technology, like AI? Are you fully behind it, that kind of thing, or are you?
No, so I look like I wouldn't be, but I'm not bad. I'm a bit of an early adopter, as long as it's easy.
Yeah. Well, that's sort of the point, isn't it?
Well, I know.
Technology that should make our lives easier. I appreciate it.
Yeah.
It doesn't always.
Yes.
Have you had much sort of interaction with that? I know you say you're early adopter. Like, how much of the job do you think has changed in the past few months?
Well, no. But if you go back, how much my job as a GP has changed. So I started, well, obviously pre-Google. I started pre-mobile phones, pre-computers.
Okay.
Yeah, so you look at the day-to-day working of a GP, and we did all our own on call. So if you went out on a visit, I had to, leaving that person's house, I would then have to phone home and see if anybody else had phoned the home line to go out and do another visit at 3 a.m. So, and all paper records, all handwritten repeat prescriptions. So that the job as it is now, we just accept those changes, a wide scale adoption, and it will be the same. I mean, that was 30 years ago, and in 30 years, the changes will be equally transformative, I'm sure.
Fantastic. And final thoughts from you, Claire. If anyone's not been to the Confed Expo before, they're considering coming either tomorrow or next year, what would you say to them?
Oh, come. I mean, you learn and you meet people and you have the conversations. And it is, so the individual talks and conversations are, you will always learn something each one. You will meet people, you will have conversations with people that you have only seen their name on an email. And it's those connections that I think we've lost during the pandemic that actually why it's so important that you come in person.
Brilliant, Claire. It's been an absolute pleasure
Thank
talking
you
to you.
very
Thank you very
much
much for your time, and I say go and enjoy the rest of your day.
Thank you very much.
Thank you.
Thank you.
That was Dr. Claire Fuller there joining us here in the studio. But stay